I think the big deal is that the degree that patient engagement has been widely used so far has been very limited. It's been these patient portals where a patient can come and view their clinical record. The traditional ones have not provided any way for plans of care to be given to the patient, for patients to record their activities and close that cycle of communications. And that's exactly what our product does. And the traditional models for patient engagement haven't provided the tools and the mechanisms to do that. And with the need for containing healthcare costs, the requirement that the patient is inserted as part of their own care plan and has the ability to provide information about their own at-home care, which is, again, the majority of health information. If you look at a patient with diabetes, a clinical organization, a hospital or doctor's office may have 4 blood glucose readings a year. Diabetic patients often take 4 blood glucose readings a day, so they really don't have much information about what's going on in that patient's life. And without that information from the patient, you can't really effectively help manage their care. I've had type 1 diabetes for almost a quarter of a century, and managing that, I've been very successful in managing that myself in conjunction with my doctors. And I'm using these home health devices, continuous glucose monitors and whatnot, and have all of my data going into my IPHR record, where that can be shared easily with my care team. The Instant PHR is a software tool that was designed to be very easy to use, especially for the patients. If you can't figure out how to use an application without reading a manual, then the designer has failed. So we've really emphasized making it very, very simple for patients to understand the information that they're seeing, to do the tasks that they're being requested, and to engage effectively with their own personal health information. I do check my levels a couple times a day, but it's been made a lot easier for me because I use a continuous glucose monitor. This is a device that there's a sensor embedded in my abdomen. It's basically a little bandage sticks it on, and it takes a reading automatically every 5 minutes. So I mentioned that hospitals have 4 glucose readings a year on many patients. I get 4 glucose readings out of this every 20 minutes, and it really does help. It's a passive way of monitoring my blood sugar, but will set off alerts and whatnot if it gets out of range. What this is showing right now is a dot here for each glucose reading it takes. This is currently showing a time span of about 3 hours, and every 5 minutes this automatically takes a reading. You can see right now my blood sugar is at 92, which is sort of an ideal level, and the horizontal arrow up here indicates that the trend is steady. If the arrow was pointing up or down, I would know instantly that not only what my blood sugar is right now, but the direction it was heading and how quickly it was heading in that direction.